Hi, everyone. Thank you so much for joining us this afternoon. My name is Jenny Askew, and I'm a registered dietitian who specializes in integrative and functional nutrition. And we are going to be talking about tests that you might not have had done by a gastroenterologist, but might help you move forward on your journey to solving your digestive problems. And just a little bit about me and my practice before we get started, so you know who's speaking. I'm Jenny, and then I have Erica and Catherine as associates on staff. And also, Jordan is our awesome VA who helps keep things running behind the scenes. Everyone on staff at my clinic is a registered and licensed dietitian with additional training in integrative and functional nutrition. So, a little bit more about me. I have a master's of science and I have an additional 3 years of training in functional nutrition. So after I got my master's, I went and did a few more years of training. And my undergrad's in kinesiology, which is exercise science. I'm an ACSM certified exercise physiologist. I'm also a cancer survivor, a wife and mom, and I've been in private practice for over 12 years. And our clinic offers a lot of different types of testing. Today, I'm going to talk about the ones that I think impact digestive health the most and the quickest, and give us kind of the biggest bang for our buck in terms of getting the answers that you need quickly and really understanding what the root causes of your digestive symptoms are. And then when it comes to digestive problems, we even want to go a step beyond just understanding, the root cause of the situation, but we want to understand why we were susceptible to the root cause in the first place so that we can prevent digestive issues from coming back. Okay, so what I think is most important and where I see a lot of practitioners kind of miss the mark is celiac and gluten sensitivity testing. And a lot of times we'll have people come into our clinic and they'll say they've been tested for celiac disease, but it's actually quite nuanced. And a lot of people aren't understanding that with the testing. So when it comes to the testing, in order to test positive, you have to have been consuming gluten, and the amount of gluten you have to consume is roughly 2 slices of bread per day for about 4 weeks leading up to the test. So, a lot of people, if they suspect celiac, they've already gone gluten free and are feeling a lot better off of gluten products. So they might not want to add them back into the diet, but because this test is looking for antibodies, as you can see here, um, you're not going to test positive for an antibody if you're not consuming the food. It's going to be really hard to do that. It's actually impossible. So anyone who's gluten-free and has taken a celiac test and it's been based on antibody levels, that's not an accurate test. What is always accurate and pretty safe is making sure you have the genetic testing done, where if you do not have the celiac gene, there's a very, very, very slim percent chance that you could have celiac. If you do have the gene, it could help rule it in, but not having the gene helps rule it out in most cases. The gold standard for celiac is a biopsy of the small intestine. You have to qualify for that normally by passing this antibody test. So if you took gluten out of your diet, didn't have any antibodies, you're obviously not going to qualify for the next round of testing, but genetic is always a pretty safe bet in terms of ruling it out at least. And you don't have to consume gluten because it's based on your genes. So that's really helpful to have that kind of in your back pocket if you've missed the window or the chance for a proper celiac diagnosis, but just want to rule it possibly in or almost totally out based on genetics. So that's a big one I see a lot of mistakes being made with. Another one, and I could really get into the nuances of SIBO testing and talk about it all day. But SIBO testing should be done anytime there's bloating. Bloating is a hallmark sign of SIBO. And it should also be treated based on the type of gas that's produced in the small intestine with the testing. And when we're doing that, you need to know what type of SIBO you have because the treatment for it should be based on the type of overgrowth, whether it's hydrogen or methane, or even a newer type that's not on this test, which would be hydrogen sulfide, which is typically indicated by a flat line, which many people, I myself in the past am guilty of this, would look at it and think it was a negative SIBO test result, when in fact it could be positive for hydrogen SIBO. So now there's three types of SIBO, all three requiring different recommendations for how it should be treated. Um, and what's really interesting here is that whether it's antibiotics or herbs that you want to use to treat the SIBO with, you really want to base the treatment on the type, but then you also have all of the workup that you want to do to figure out what the root cause of the SIBO was and why you were susceptible to SIBO in the first place. So a lot of time with that, we're really working during a SIBO protocol, a proper SIBO protocol, to support digestion um, from the top down. So we're looking at, ensuring that enzymes are being adequately produced, ensuring that there's adequate stomach acid, ensuring that probiotics and prebiotics are on board along with the protocol. And then, the proper agents are being used based on whether the patients presenting with hydrogen, methane, or hydrogen sulfide SIBO. So all of those things need to be taken into account, and then understanding why you got SIBO in the first place. So were you someone who was on antacids for a long time? That could contribute. Were you on antibiotics for a long time? Head injuries, actually concussions, can contribute to SIBO too. So really understanding why, and there's several other things too. Those are just a handful of examples, but understanding why the SIBO happened in the first place. And another test we really love is stool testing. So we use the Genova GI effects for that. And this is a really interesting test. You get 20 pages of a report on your GI health, and it involves a 3-day stool collection. And what we're looking at, really, we break it down into each section that you see here, but we're looking at a need for digestive support. We're looking at inflammation levels. We're looking at dysbiosis, metabolic imbalance, and also infection. And then under each of these, we can break it down further into markers that tell us what's really going on in the gut. So this test is looking at pancreatic function. Are you producing enzymes? Do you have adequate stomach acid levels? We're looking at probiotic status. We can see your prebiotic status. We can look for overgrowth of bad bacteria or yeast. It's super, super interesting what we can find with this test. So this is really essential, I think, for anyone to have done who's been experiencing GI symptoms and hasn't had any real relief. And then another favorite of mine is food sensitivity testing. This is really helpful anytime there is an infection in the gut or a leaky gut. This really helps to decrease inflammation in the gut and allows everything to heal faster and work better. So this is not allergy testing. It's actually MRT. It stands for mediator release test. And this test is used to show you if different foods are causing inflammation in your body, and it's looking at the cells releasing mediators, and these mediators cause inflammation. So the cell size will actually change when particles of all of the tested foods are introduced to the cell. And depending on how much the cell changes in size, it will shrink or stay the same size. Indicates how much inflammation is being caused by that food, because that can tell us how much mediator was released during the testing process. And that tells you how reactive you are to different foods. And when we take out reactive foods in the diet, the body actually has a chance to heal. And instead of fighting these inflammatory fires, which were really a result of an overactive immune system, the body can divert its energy and resources to actually healing and recovering from things like gut infections, leaky gut. It decreases physiological stress on the body too. It's really a great way to get a personalized approach to decreasing inflammation and healing your gut.